Let's talk about the state's opioid crisis. Kentucky has been hit pretty hard when it comes to the opioid epidemic. So a lot of people talk about the difference between treatment and incarceration, but it seems like a lot of times people end up being incarcerated even though they're addicts. So where are we at on this issue, and how do we get more treatment involved with this issue?
Well, let's be clear. We do have thousands of people locked up due solely to their addiction, to their substance use disorder. Not all opioid use disorder, could be any number of disorders, from alcohol to other drugs. It is an epidemic, a pandemic, some would say, in our state and our country. Kentucky is 10th in per capita incarceration, 2nd in female per capita incarceration. To give you some indication of how troubling the female per capita rate is, the state of New York has roughly 1/3 the number of women in prison as the state of Kentucky. That's unthinkable to me or anyone else who studies these kinds of numbers. And the women we have in prison, almost to a person, are nonviolent and deal with some type of mental illness or addiction, and it's a tragedy. So incarceration is the result of addiction. I don't think it should be that way. I think we should adopt a public health first approach. I don't believe a criminal justice first approach is the way to go. Oftentimes addiction leads to other crimes, and those are unavoidable in terms of ending in incarceration. That is a consequence sometimes of an act that is born from the addiction, whether it be theft or something worse. And so we do have to deal with that reality, but oftentimes adopting a public health approach for someone who has a minor crime or just has a possession charge or was peddling, selling a drug to support a habit, a very low-level trafficking charge, rather than thinking that punishment will fix the problem, we have to adopt a different approach. I mean, I heard someone I trust very much one time say we can't punish people to sobriety. It doesn't work. In fact, in this country, we've been trying to do that since roughly 1970, and look where we are.
Now, recent numbers I've seen show that there are far more overdoses, way more overdoses than even car accidents or murders.
Suicides, all those
everything combined. And it's gotten to the point where even normal people like you and I are having naloxone in their bag or somewhere on them to help someone who's overdosing, who has no medical training at all. Does this speak to the magnitude of the problem here in Kentucky?
Well, yeah, you can pick any year over the last several years, and we've lost more people in this country in 1 year to drug overdose deaths, preventable drug overdose deaths, than we lost during the entirety of the Vietnam War. And as you said, you can combine, in most states you can combine traffic accidents, suicides, and homicides, gunshot murders. They are all eclipsed by overdose deaths. We, thankfully, in Kentucky, and I don't mean to paint a rosy picture here with this, but there is some light at the end of this tunnel. We think, we're cautiously optimistic, that we're one of the few states where overdose deaths are being driven down. We know that we've driven prescriptions for opioids down nearly 100 million a year since 2011 and 12 timeframe over the past 7 or 8 years. And that's significant, and that's due to policy choices, that's due to landmark legislation, that's due to innovative solutions. It's intentional. It just didn't happen overnight. Kentucky has the gold standard, as you know, for prescription drug monitoring programs called CASPR. It was the first. The national model was supposed to be born from it. And we're the first state in the country to mandate the use of CASPR, our drug monitoring program. We're the first state in the country to adopt the CDC's recommendation, the Centers for Disease Control's recommendation, that we limit prescription drugs for acute pain to 3 to 5 days. And why? Because we know addiction can begin between 3 and 5 days. So why would we take the chance on someone? Why send them home with a bag of 60 Lortabs when they need 2 or 3 to get through some intense pain, some acute pain? And there are exceptions to that for folks who deal with chronic pain and for doctors who have good reason for that. But that's had a good effect, and that's also will have the effect of addicting less people on the front end and sort of closing the top of that funnel, because we simply can't handle those who are coming out addicted because of bad choices, not necessarily on their part, but prescriptions, and sometimes just an addiction that begins after an oral surgery for someone who's never taken a drug. So another example of that, 80% of those who use heroin today began with a legal prescription pill. So it's not as if people just immediately seek out heroin. And that just doesn't happen by and large. That's a rarity. And so we need to understand how we got here. This is a preventable plague we've really inflicted upon ourselves. And we can, the good news is we can dig our way out of it.
Obviously, this has a huge impact on families across Kentucky. It has a huge impact on individuals, but also it has a big impact on the state as a whole, cost-wise, too.
Oh, it's
healthcare, all the other aspects.
I think it's incalculable. I really do. I think it's in there are numbers nationally. I mean, to interrupt your question.
No, you're answering my exact question. What does it cost the state?
We don't have a number because I think it's in the billions that it costs our state. Let's look at incarceration. When I was growing up, and let's go back to when I was a toddler in 1970, we spent $5 million on incarceration. We had 3,000 people in prison. Today we have 24,000 people in prison. That doesn't include county inmates in county jails, but that's 24,000 people committed to state custody. And that costs us, at the end of this fiscal year, it'll cost us at least probably $650 million. That's a 700% increase in population, while the state's population overall has only risen 38%. So again, keep that in mind. The prison population has exploded 700%, while the state's population generally has only increased 38%. Are we more evil? Are we committing more crime? Actually, we're not committing more crime. We're a top 10 state in terms of our overall safety numbers. We were in 1970. We still are today. Crime is not on the increase. There are a few zip codes which have experienced some additional homicides, but that's not really a result of the opioid crisis. That's unique to a geographical area in our state. But crime is not up. And same with juvenile crime. We've cut our population in half due to some very good policy choices. We've closed facilities, and juvenile crime is not on the rampage. It's not increasing. What we see is that our prison population is almost all driven by this approach we've taken to what is a pandemic in terms of addiction.
And I want to come back to criminal justice issues, and this kind of ties into that as well. There's been kind of a culture shift over the last couple of years. We used to tell HR people to stay away from anyone with substance use disorder and anyone who has any sort of criminal record. Obviously, the business community and others have been getting involved with expungement and other things, and now the business community is starting to get involved in the opioid crisis as well. How do we continue to kind of change the way that we see these issues and be more accepting as a society?
Well, let me first say I think we're in a prime position in our state. I think we are a national leader in drug policy. We certainly have become a leader in criminal justice reform over the years, even though we have incredibly high numbers and high rates of per capita incarceration. The good news is we're no longer leading the world in prison growth. We're not number one. At one time, as you know, we were leading the world. We were almost quadruple the national average in prison growth. We do have a population that is still trending a little bit upward due to some policy choices, I think, and some rollbacks of the reforms, parole grant rates. There's a lot of things that are happening. There's not implementation of some of the reforms, but we're no longer growing at this incredible pace, and we've slipped back to 10th, and I hope to continue to improve. But to your question, how does the business community, why should the business community get involved? I think it's there's so many reasons. I think there's a moral imperative. I think we owe it to those who are suffering. Under the brother's keeper philosophy, sort of loving our neighbor, we have to adopt that kind of sense of urgency to help those who are suffering. To those who would say, well, what's the other? What's another reason we should do that? Well, I think it's pragmatic. I think with 130 or 40 or 150,000 open jobs, and businesses and industry, clamoring. And really having an incredible need for employees, there's a time to look at the 16,000 people who are released from state custody alone every year, or to look at those who are suffering in active treatment. What we know is that those who are not in drug treatment miss about 10 days of work a year, and those in active recovery miss about 9. We also know there are a number of validated studies to suggest that those in active recovery make better employees on a number of indicators. We know that those who have criminal records oftentimes make better employees. There are a number of companies that are validating their own studies to indicate that those who have criminal records make better employees. I'll give you one. Uber, for instance, driver ratings, easy to understand. Those who have felonies actually rate higher than those who don't across the board for Uber as one. Home Depot is another national company we've worked with who oftentimes see better employees, better results from their employees who had brushes with the law, who have criminal records of some sense. Now, keep in mind as well, 70 million Americans have a criminal record. 70 million Americans. So for employers, for the business and industry community to look and say, we're not going to hire someone, well, that's not even realistic. Because, again, 1 or 3 or 1 in 4 of every adult or every possible employee has a criminal record, and not all are created equal. Some are troubling, where you just have to make a case-by-case decision, but oftentimes they're not. Oftentimes they're stale, they're old, and people have moved on. They need opportunity. Oftentimes they're as a result of addiction. So we know that someone can be kept in active recovery or has since become clean and sober and has stayed that way for some time. We know it's difficult with opioid use disorder, but the approach that we're taking now in Kentucky, and kudos to the Kentucky Chamber for joining us here at Justice and with Cabinet for Health and Family Services to build what essentially is a very innovative and unique employee assistance program, which will meld together resources. We'll have a center for data. We'll have those who are liaisons to connect employers, and we'll have an opioid task force where key employers, key business leaders will serve with those who are in this sort of criminal justice drug policy treatment trench every day, so that we'll be learning together about what the other needs. And we know, as someone who's been in criminal justice now 26 years and has seen this problem explode and has seen the results of it and has seen people recover, has seen people become engaged with employers, I can tell you I think it has the tremendous potential. In fact, that's underselling it. I think it has the potential to transform and be transcendent in the way we can get people back to work. And the way Kentucky's approaching it is not just to hire them. We're approaching it with the philosophy that a job is transformational, and it can actually aid in someone's recovery in ways that are really, again, hard to calculate. We know this with our own reentry division. We know that someone who has employment, and oftentimes battling addiction, has employment for 1 year or more, their chance at recidivism drops dramatically. I mean, in other words, their reoffense rate drops dramatically to like 17 or 18%. Someone who doesn't have that employment, that reoffense rate is 52%. It's dramatically different. So everything is out there. The evidence is clear. This is a best practice. And so employers need to go in thinking, this really isn't a chance I'm taking. This not only is the right thing to do, it is not only beneficial to public safety from a criminal justice standpoint and just a public safety standpoint, but it will benefit us. We'll get a good employee out of the mix. And and the other part of this is, look, for those who don't have a criminal record or don't have an acknowledged addiction or substance use disorder, many of those that who are already working, it's just hidden. It's there. And so to have a program which not only keeps employees engaged, if they have a problem, keeps them employed, puts them in active treatment, but also brings those who are coming out of the system, who are coming out of jail or prison, into treatment, but adding that component of a meaningful job, the dignity of a job, the dignity of work means something, and that's why it will be transformational in our state, and really bridging all these resources. We've got so many things going at once. The Kentucky Works Collaborative is one. So we've got an employee, sort of a coordinator, a liaison, at every one of our career centers, every one of them. We also have a 10-person, we have an incredible division of reentry at corrections, but now we have 10 additional employment specialists that are paid for by the federal government to get those in active treatment to work who are coming from our prison system. And that's an investment the federal government has made in Kentucky, a very unique investment. They've seen us as a leader in that, and we're very proud of that. In fact, they gave us 4 to begin with, and that number has risen to 10. They more than doubled their investment in us voluntarily because we were showing such results for that. Kentucky, we've for too long been last where we should be first, and first where we should be last. And this is an area I think where we're clearly leading the country, and I think it can transform our economy, and it can fill this incredible need, this incredible gap in our workforce.
Now, to touch on your point about recidivism, that was the exact next thing I wanted to talk about. Recidivism is down in Kentucky from the new numbers. And like you said, when someone has a job, it helps not only if they're coming out of the prison system or if they have a substance use disorder. If they get employment, it's much easier for them to not reoffend or not relapse. So do you think that is part of this culture shift where we're now, thinking more in terms of second chances and things like that? Do you think this is kind of a direct result of that, or do you think it's policy changes? What's gotten us to this point where recidivism is finally going down?
Oh, I think it's intentional. It just didn't happen. When we've been here about 3.5 years as an administration here at Justice and overall, and certainly the governor understands this problem and we connected on this problem. The governor and I were not on a personal level. We didn't know one another personally, but we came together and really shared a common goal here and a common philosophy of how to address this problem. And it's a very nonpartisan approach. That's what's so unique about this space of criminal justice reform, drug policy. It's really based on human need and based on best practice and the best results, and that's refreshing right now in a time of hyper-partisanship. This is a time when liberals and moderates and conservatives can come together, and that's really what's unique about this. But what we've done here to drive down recidivism is very clear. We inherited a reentry division to a person. The 30 people who worked in reentry, now it's over 50 we've expanded because there's such a return on investment. We needed to expand, had not connected one single returning citizen coming out of prison or jail to a job, not one. And now that's all we try to do, in addition to finding them treatment, immediate stable housing, and transportation. And by the way, we have unique and innovative programs to address all those things. We're rebuilding our treatment model right now. We are rebuilding the way we deliver transportation in a state that's still largely rural and presents challenges for those who leave prison and go home to a rural area and have to get to a probation and parole office, have to get to treatment, have to get to a job interview to maintain the requirements of their supervision or maybe go back to prison. We are changing the way we supervise. So another reason recidivism is down. Probation and parole officers now have a common goal. We have a vision where we are no longer looking to simply trail them, nail them, and jail them, as the old adage would go. We're looking to help them succeed, to help them stay in treatment, to help them, again, find that stable housing, to connect to a job, connect to family. We have a social service clinician who meets them on the outside immediately and begins that process. We try to, rather than cut off benefits they might have otherwise had that they lose in prison, we try to suspend them so they can pick them back up. And by the way, to the taxpayer who would say, well, who's paying for that? Why is that my responsibility? The alternative is much more expensive. The alternative is that you've got someone who could become a threat to public safety again, who could fall back into an addiction, and we know the results of that. We know that they could access an emergency room visit, costing hospitals millions. We know that these things cost society. So these modest investments from state general fund dollars or federal tax dollars are returning on investment. They cost a fraction of what some of the consequences are of ignoring the problem and just letting sort of life dictate what happens. We have to be intentional. And that's why recidivism is down, because, in summary, a rebuild of reentry, a rebuild of treatment, a rebuild of probation and parole, rebuild of how we supervise in the community, a rebuild of how the criminal justice system views those reentering society.
And the tax dollars is a really good point. The cost of incarcerating someone is extremely high. What is that number right now?
It varies by facility, but on average it's at least $25,000 per individual per year.
Right, which is incredibly high. And there have been a lot of policy changes to try and decrease how many people we're incarcerating and for what, especially when it comes to drug offenses. But it seems like incarceration is still up in Kentucky.
It is.
Why is that, and how do we address this issue? Because it is costing the state a huge amount of money.
Well, again, the good news is we're no longer leading the world. As I said, we're no longer, at almost quadruple the national average for prison growth. And that was at a time when all state prison populations were exploding. And as a country, the United States leads the world in incarceration. We comprise 4.5% of the world's population, yet we incarcerate 25% of its prisoners. For women, it's worse. 1 out of every 3 women incarcerated worldwide is in the United States. Kentucky has the second highest rate of female per capita incarceration. As I said, more children impacted by incarceration in our state. 34,000 children impacted by incarceration is either number one or two. Very troubling, devastating to communities. As chamber president, your boss said one time, we have decimated our workforce, our people, with incarceration, and addiction certainly has played a large role in that. So addiction and incarceration have led to this gutting of our own people in Kentucky, and we have got to turn that tide. And I think that's critical. So again, incarceration is up, I think, for several reasons. So the good news is we're not sitting at 35,000 as some projected by now. We're at 24. We're more stable than we were. The problem is the parole grant rate is so far off where it was projected to be, and the paroling of individuals is not happening as I think it's intended. There are ways to safely parole people into treatment, into community supervision, where it's more effective. Prison can be criminogenic, meaning it can make somebody worse. So proper supervision in the community, safe supervision, where especially for low-level nonviolent offenders and even some who have more troubling charges, it can be done safely, and that's proven across the country. I mean, Texas is leading the way. Texas has led the way. Georgia, South Carolina. There are other similarly situated states to ours, whether you want to look at those as similar political states or close to us in geography. But certainly no one would accuse Texas of being soft on crime, yet they've used supervision. They avoided building 7 or 8 new prisons. They've closed 4 prisons. They've cut their population. We haven't made some of those same common sense decisions. We've made some. We undertook some significant reform in the form of House Bill 463 in 2011, and it's the reason we don't have 10 or 11,000 more people in prison today. But there's a lot of discretion built in that bill, so judges and prosecutors and others can opt out of using some of those tools. Where they're used, they're effective. The parole board, they don't have to parole anybody, and they're not paroling at near the rate that was projected. It's 20 or 30 percentage points off at any given time. That's thousands upon thousands. It's a compounding effect of individuals. I think for whatever reason, I don't think in 2011 we saw, even though there was clearly a problem, we did not see this explosion, this opioid use disorder explosion with prescription pills coming and devastating us like it did in terms of its impact on incarceration. So that has been another factor that's very difficult to see. And I think the reaction sometimes is just to tighten our grip and use crime and punishment models to address what is a chronic brain disorder, a disease, which, by the way, by definition, is all about relapse. That's what addiction is. That's what substance use disorder is. And that reality is not really reflected in the way our criminal justice system handles it. It's some of the reform built that in, but oftentimes, I'll give you an example. So what we try to do with probation and parole, if somebody's out and they're battling an addiction, that's their true crime, which I personally don't think addiction should be a crime, but it still is, essentially. Possession will land you in prison. And for those who say, well, we never put anybody in prison for possession, well, I've got about 2,000 people to prove otherwise in state prison right now. So I don't buy that anymore, and I'm actually tired of hearing it. Now, some work very hard to keep those with addiction out, but as a general rule, I'm tired of hearing that. So probation and parole officer, which again, we have such a shortage of those, and they have incredibly high caseloads, twice that of Texas. But rather than looking to snap somebody back into prison for their first failure, for a technical violation, we had 6,000 people return to prison in 2016 for technical violations mainly. 97% of those were returned for technical violations of their release, not a new crime. So it could be a failed drug test. So wouldn't common sense dictate that someone fails a drug test rather than return to prison for some inordinate amount of time, costing the taxpayer thousands of dollars, making that individual worse? Why not return that individual to treatment? Why not try something different in active community supervision, which costs a fraction of what incarceration costs? That's what we're trying to do, and we've cut our revocation rate by 10%. The legislature did pass something that will help us with discretionary detention and graduated sanctions that we've been using already, but they passed something in this last legislative session. We appreciate that. That will help us at probation and parole. Now we just need money to hire enough officers and increase those salaries, which, by the way, we've done that with not an additional appropriation. We can't fill the job, so we've used that money to fund raises for those to help retain the good officers we have rather than lose them, because we lose them to federal jobs, to county jobs. The state continues to lag behind the rest of the country and the rest of our state, frankly, in pay. Oftentimes state jobs can't match county jobs. They certainly can't match federal jobs. So we lose people all the time who would otherwise be very effective officers for us. And that's not just probation and parole. We have shortages with corrections officers. We have the same dynamic with our state police under justice. And by the way, we are connecting everything under justice. I know we have limited time today, but we could use this entire segment to discuss the advances we've made and the innovations we've made with the Kentucky State Police by using the Angel Initiative, helping get people into treatment who come to state police posts rather than incarcerating them. We're going to place victims advocates at state police posts. I mean, that is an advancement that is way ahead of the curve nationally. And I think most of what we're doing at the state police now is seen as leading the country in this area that all fits together to help people get clean and sober and back to work.
And I want to talk to you about another policy issue in just a second, but let's kind of wrap all of this, what we've just talked about, up. And if you have the figures on, obviously we just said that it's about $25,000 to incarcerate someone. What does it cost to put them in treatment?
A fraction of that. It's all over the board, but it's unfathomable to think, unless it's a year-long residential treatment. But here's what people forget, or those who don't really deal in this as much. Sometimes the best treatment is intensive outpatient, is a community-based treatment. Can be done through one of our community mental health centers, can be done through a faith-based component, a faith-based treatment option. There's always the idea that we have to place somebody in residential treatment is actually not always most effective. In fact, I would say the majority of the time it doesn't have to be. And there are many reasons for that. The treatment professionals could explain better than I. But I would tell you that it's difficult for someone who, there are triggers in communities, and there are difficulties for those who leave residential treatment and return to a community and to the very same people they were engaged with when they were addicted. And so they have to, by using an intensive outpatient approach, by keeping them in that community, or by moving them to another spot and doing the same thing, you're sort of removing some of those triggers as one example of why intensive outpatient treatment is better. But it can be just as intense, it can be just as effective, the same models are used, and so that's the most cost-effective way to do it. And by the way, it's often the best way to do it.
Okay, so let's talk about another cost issue, and that is bail reform.
Oh, wow.
Yeah.
Yeah.
You talked a little bit about judges and discretion and how that ends people up back in jail sometimes. This issue has to do with that in some ways as well, but basically there are a lot of people who can't afford bail and they end up sitting in jail for longer. The legislature sort of started to talk about it, but has not done anything with that issue yet. What do you feel needs to be done on that, and do you feel it could get done maybe in the 2020 session?
I hope and pray. It is one of the single best things we could do for our state and for our own people. It's one of the single best things we could do for county budgets and the countyans, the Kentuckians who live in those counties as well, and for our system. Our jailers are supportive of it. I think so many in law enforcement are supportive of it. So many on the bench, so many prosecutors. There are a handful who continue to oppose it, and it's a matter of education. But the size of the problem, the gravity of it, is hard for the public to understand. But let me put it in this perspective. So for the year 2016, I use this because it sticks with me. There were the AOC, the Administrative Office of the Courts, our judicial branch, told us that there were 37,000 low to moderate risk offenders sitting in county jails, pre-trial, haven't been convicted, haven't pled or gone to a jury, all manner of charges, but they were assessed as low to moderate risk. In other words, most would say that they could be actively and safely supervised, the vast majority in our communities. And judges agreed, because by and large, those individuals were placed on very low bond amounts, sometimes as low as just a few $100. Let's use 500 as a low bond amount. Well, there are several people who 500 wouldn't mean much. In fact, in Kentucky, we have no way to preventatively detain someone who presents a threat. You just have to place an unusually high bond amount on someone who presents a threat. To give an example, someone could commit the most grisly of crimes and the judge could set a very high bond amount, but if they could meet that, they can buy their way out of jail. To me, that's un-American. It's not within our Constitution. It's unconstitutional. Courts are beginning to agree. And so the use of money, that was never intended to be bail. Bail is about release. And we either ought to release someone or not. It shouldn't be based on their ability to pay. I think that is, again, I think it's immoral. I think it's unconstitutional. And I think it's ineffective. I mean, it's not effective. And so back to this problem of the 37,000 offenders who were low to moderate risk, they served in county jails, who, by the way, don't have, I mean, by and large, there are no counties who need to be spending money needlessly on this. Most counties are in real financial ruin over county jails, over operations, and many are close to bankruptcy, if the truth were to be known. So 37,000 of these offenders served an average of 109 days in jail. That, any way you slice that, any kind of per diem, that's over $120 million needlessly spent. Now, that doesn't calculate the human toll that it took on those 37,000 people who lost jobs, lost families. In fact, there's an effort we're involved in now called 3 Days Counts. Mm-hmm. And that's, again, we're one of the few states really tackling that with the Pretrial Justice Institute, and our judicial branch is taking the lead on that. But essentially, that stands for this philosophy where you just headed, which is just after 1 or 2 or 3 or 4 days in jail, a person's life can end up in shambles. Mm-hmm. They lose connections with family, lose their job, their children. And that we have so many women in prison. That's why we have more children than any other state in the world, any other state in the country, but certainly in the world as well, because we lead the world in female incarceration. So it's devastating, and it could be reversed. I don't mean simply, but there's a plan. Eliminate the use of cash bail, of money bail, and release people who pose no threat or who pose minimal threat, who can be actively supervised. And we have precedent for that. We're now arresting fewer people in Kentucky. We use something called citable only offenses, give somebody a citation for certain things. And by the way, we've learned the sky didn't fall. That was something I supported. It was a piece of legislation I sponsored, which was supported by a number of prosecutors. And they were right. Law enforcement who supported it have been right, and they're using their discretion wisely. They're arresting thousands fewer. The first year alone, 18,000 fewer people were arrested. And guess what? People still showed up to court at the same rate, and no more crimes were committed by this population. The public safety factor, as it's called, was not negatively impacted. And the same would be true of bail reform. We'd be one of the first states to do it. There are a couple states who have gone before us now. We wanted to be the first. Kentucky is only one of 4 states who don't use bail bondsmen. Bail bondsmen, I'm certainly not in favor. I won't say anything any worse, but let's just say I'm not a favorite of Dog the Bounty Hunter and his crew. We're not in favor of it, and they were driven out of our state in the mid-1970s. Thankfully, we don't need that. We have unified pretrial. We have the only unified pretrial system in the country. It's the gold standard, but we still have roughly the 10th highest rate of pretrial detention. So that shouldn't be. People are being detained needlessly, and it's busting county budgets all over our state, 120 of them, and many of them simply can't afford it. And while I have a moment on that, I've got to continue to signal what I think is Kentucky's biggest criminal justice problem. I mean, obviously, mental health, addiction is what everybody would point to, and that's true. But the single biggest problem with our infrastructure, with our fundamentals in Kentucky, is the fact that we house roughly half our state inmate population. We're mandated by law, when somebody's committed to the Department of Corrections, we are mandated to house that individual, if they're a Class D inmate, the lowest level felony, or some Class Cs, in a county jail. We have 76 full-service county jails across our state, 120 elected jailers, independently elected jailers. We're one of the only states, if not the only state, to elect jailers. It's unique. They're not required, to work in the field. They're just independently elected officers. Some of them, do incredible work, and many of them are learning on the fly. It's very challenging to them, having not worked in this field, so it presents challenges. But we have 76 of these jails. Only a third of them roughly offer any kind of real substantive treatment. Give you an example, 23 have some form of drug treatment. All of them should have that. We're housing 12,000 inmates, the vast majority of whom have a substance use disorder and they need treatment. But it's luck of the draw in terms of whether they actually get that or not. And there are a handful of other jails who offer maybe a program like one night a week. Well, that's not really the kind of corrective programming that would begin to rebuild that individual's life and rehabilitate them towards successful reentry. And that's why recidivism is much worse for people coming out of jail than state prison, where we have programs and we have treatment. We'd like more. We'd like to continue to work to be more effective. I don't mean we're not every day working. We've not, solved that issue yet, but we've come light years from where we were. But many counties, and this isn't the fault of those counties. These jails are not built that way. They're built for temporary housing. They're not built for long-term incarceration. So there's no room. And oftentimes they are taking every available space. They're sleeping in floors. That we are warehousing our people in these jails, oftentimes in very inhumane conditions, oftentimes sleeping on floors and puddles before fire extinguishers and not sleeping in beds and quadruple bunked if any bunks at all, and that's not indicative of all, but sadly that's far, far too many. And only one other state does it like we do it, and that's Louisiana. Now California has moved to place some of their low-level offenders in county jails, and for some reason they thought that was a good idea. They're learning now it's disastrous. It's producing bad results. We could have told them that. And that's just a problem we have to face. Now again, that does not diminish some really good work by our jailers in very tough situations, but it is a fundamental issue we have to address in our state, a fundamental problem of infrastructure as it relates to incarceration in our state. We've got to do something, whether it's build jails that look more like prisons, expect more, build in more money to pay. The per diem amount hasn't been raised, so we're not even paying, in their defense, we're not even really paying enough for them to offer the kinds of things we need. We pay $31.34 a day, and we pay an additional $9 for substance abuse treatment. And oftentimes, jails won't take us up on that because they don't have the space to do it. They're not built that way, and they just don't have the ability to do it. Their counties just don't have the ability to stand up those type programs. But we have so many people and we're overpopulated that we have no choice but to spread these nearly 12,000 state inmates out in these 76 jails. So it's not a matter we can say, well, this jail is doing it well, so we're going to give all the inmates to this one jail. We can't do that, but we don't have that luxury because we have such space concerns, capacity, pressure at this point.
So to wrap everything up,
Yeah.
is there anything that we haven't covered that you think it's important for people to know, or that you feel that people aren't fully understanding? And where do we go next, especially on the issue of opioids? Obviously, Kentucky has had a lot of drug issues in the past, and it seems like, we're sitting in your office right now, you have Dreamland over there. I've spoken to the author of Dreamland before, and I asked him, there's always one drug, and we think we're moving on, and here comes the next one. So how do we as a state move forward on this issue in particular and kind of solve some of these issues down the road as well?
Well, despite the heroic efforts as it relates to drug issues generally, we've learned some painful lessons, but we're in this country. This is not just about Kentucky, but we've learned some, and I think Kentucky in more ways. In fact, I think we are, by any objective measure, Kentucky is a top 5 state in terms of innovative drug policy. We are a national leader. We're a state of firsts in so many regards. I mentioned a couple of them. So that's what we should be proud of. We've had to be innovative. We've had to put political differences aside and adopt things like syringe support programs. Now we've become a national model there. President Trump's Surgeon General says that Kentucky is a national model, and they're now supportive. When just 4 years ago, when we talked about this as a solution, we didn't think we'd have but a handful. Maybe Lexington, Louisville would take us up because it's local option. But now we have 56 programs across our state. I mean, that's 56, think about that. And they get people into treatment at a much higher rate. They save millions in tax dollars. They protect law enforcement from needle sticks. They get these needles off our playgrounds. They build trust with people who are in active addiction, and they get them to a place where they can begin to recover. It's not really about the exchange. It's about a harm reduction approach. And that's why Kentucky, we've been able to put down our political differences and our opposition to things we don't know about or might scare us to get to the best policy. So what we've learned, I think, is that simply trying to incarcerate our way out of this, locking everyone up who has a problem, that is it's just a failure. It doesn't work. And we've been, again, as a country, we've been doing this since 1970 or 71, and we know now we have to take a public health first approach to this problem. That doesn't mean we don't use all available resources to go after the high-level commercial traffickers and cut off the supply of these poisons coming into our state and our country. That's not the issue. But despite the heroic efforts of law enforcement, let's use our own state police. We have very dedicated, specialized units who interdict, who can take high-level traffickers on. That's what we need to be doing. But if we're spending all our resources, and we do as a state, with so many agencies, whether they're municipal or county level agencies, federal agencies, state agencies, if we're spending all our time criminalizing addiction and disease, we can't actually get to what could help, which is cutting off the flow of these incredibly dangerous drugs. Another drug that people aren't talking about now that's really never left, but this incredibly pure meth that's coming across our southern border now, and it's just killing us. And the difference with opioid use disorder is that opioid use disorder often results in an overdose death. Meth often results in death due to violence, and often results in more crime because it affects people differently. It oftentimes, again, as one law enforcement official said to me in this building just yesterday, we know, makes them feel 10 feet tall and bulletproof. And oftentimes it's far more dangerous for an officer. An officer can encounter someone who is addicted to heroin or pills, again, opioid use disorder, and can shepherd them into treatment. But someone who is actively engaged with meth oftentimes is far too combative and is a danger to that officer and anyone around them. And that's what's popping up again. It really never left, but it seems to be on the rise. And so if we continue to essentially waste criminal justice resources on something that doesn't return on investment, that makes people worse, again, incarcerating those who need a public health approach, who need treatment, who don't need a prison or jail cell, then we'll continue to divert resources from the very people who need them the most on the front lines, battling true crime and battling things they could have an impact on, like our thousands, our over 8,000 law enforcement frontline officers across this state. And that's critical. That's one thing I would tell people. And the other way I would say is that we as an administration and as a task force, there were legislators on the task force, there were judges, there were many who came together, all the stakeholders, mental health professionals, treatment professionals, who a couple of years ago suggested 23 policy recommendations that could have been adopted by the legislature. None of them were. Now, the year before, in 2017, we did have a very effective piece of legislation that has yielded incredible results to help us drive down recidivism, and that's Senate Bill 120. It's basically a reentry bill. Very good piece, made us a national leader in reentry. We've been very present with a very bipartisan effort through the First Step Act, which built on the same principles now at the federal level. That's why we've had such a high-profile presence at the White House, with people coming together from the left, political left, middle, and right, not just those at the White House, but using the White House as sort of a way to say we can agree on one thing, and that's reform. And that's why, again, I have hope. But for some to reject those policy recommendations, those 23 recommendations from our CJ PAC, the same ideas that have helped Texas be so successful, Georgia be so successful, South Carolina, and even now Louisiana and Mississippi, even those states to be successful, that has to change. We have to continue to educate. Maybe it's something we need to do more of, but I think we have to have the business community take up this mantle for us. And let me say this, the business community has, by and large. Kentucky, that's another place where the Kentucky Chamber has been a national leader. When I used to travel years ago, as far back as 10 years ago, I can remember beginning this discussion as far back as 2009, begin this discussion of needing significant criminal justice reform. and then beginning to understand what a national role Kentucky was already playing with its business community, and the Kentucky Chamber specifically saying we need to right-size prisons. And I'm referring to the old leaky bucket report, where we were allowing corrections to siphon so many valuable resources away from education and workforce development. And so we need now our business community to stand up, not just in this battle against opioids and addiction and getting people back to work and letting them again retrieve and re-engage in the workforce and get dignity back, but also to stand up and say we can do better with our policy choices. We don't have to use incarceration in ways that results in leading the world in incarcerating women and affecting our children and decimating our families in this way. We can do better, and I think that's the message. We have to have people. It's almost a call to arms, and it's critical that we come together on this issue and we not let another legislative session pass us by without significant criminal justice and drug policy reform.